NCLEX RN Questions 2026 that challenge your critical thinking skills. Question 1. Nurse Jenny is instilling an otic solution into an adult male client's left ear. Nurse Jenny avoids doing which of the following as part of the procedure? Option A. Pulling the auricle backward and upward. Option B. Warming the solution to room temperature. Option C. Placing the tip of the dropper on the edge of the ear canal. Option D. Placing the client in a side-lying position. The correct answer is option C. Placing the tip of the dropper on the edge of the ear canal. The nurse should avoid touching the ear canal with the dropper tip to prevent contamination of the medication bottle. Question 2. Nurse BEA should instruct the male client with an ileostomy to report which of the following symptoms? Option A. Absence of drainage from the ileostomy for 6 or more hours. Option B. Passage of liquid stool in the stoma. Option C. Occasional presence of undigested food. Option D. A temperature of 37.6 degrees Celsius. The correct answer is option A. Absence of drainage from the ileostomy for 6 or more hours. Absence of drainage for 6 or more hours in an ileostomy is a sign of a potential bowel obstruction and must be reported immediately. Question 3. Jerry has been diagnosed with appendicitis. He develops a fever, hypotension, and tachycardia. The nurse suspects which of the following complications? Option A. Intestinal obstruction. Option B. Peritonitis. Option C. Bowel ischemia. Option D. Deficient fluid volume. The correct answer is option B. Peritonitis. Fever, hypotension, and tachycardia in a patient with appendicitis are classic signs of peritonitis following a ruptured appendix. Question 4. Which of the following complications should the nurse carefully monitor a client with acute pancreatitis? Option A. Myocardial infarction. Option B. Cirrhosis. Option C. Peptic ulcer. Option D. Pneumonia. The correct answer is option D. Pneumonia. Acute pancreatitis can cause respiratory complications such as pleural effusion, atelectasis, and pneumonia due to inflammatory mediators. Question 5. Which of the following symptoms during the icteric phase of viral hepatitis should the nurse expect the client to inhibit? Option A. Watery stool. Option B. Yellow sclera. Option C. Tarry stool. Option D. Shortness of breath. The correct answer is option B. Yellow sclera. The icteric phase is characterized by the onset of jaundice, which is most easily observed as yellowing of the sclera. Question 6. Marco, who was diagnosed with a brain tumor, was scheduled for craniotomy. In preventing the development of cerebral edema after surgery, the nurse should expect the use of Option A. Diuretics. Option B. Antihypertensive. Option C. Steroids. Option D. Anticonvulsants. The correct answer is option C. Steroids. Dexamethasone, a steroid, is commonly used post-craniotomy to reduce inflammation and prevent cerebral edema. Question 7. Halfway through the administration of blood, the female client complains of lumbar pain. After stopping the infusion, Nurse Hazel should Option A. Increase the flow of normal saline. Option B. To assess the pain further. Option C. Notify the blood bank. Option D. To obtain vital signs. The correct answer is option A. Increase the flow of normal saline. After stopping a transfusion for a suspected reaction, the nurse must keep the line open with normal saline to maintain access for emergency meds. Question 8. Nurse Maureen knows that the positive diagnosis of HIV infection is made based on which of the following? Option A. A history of high-risk sexual behaviors. Option B. Positive ELISA and Western blot tests. Option C. Identification of an associated opportunistic infection. Option D. Evidence of extreme weight loss and high fever. The correct answer is option B. Positive ELISA and Western blot tests. A positive ELISA followed by a confirmatory Western blot test is the standard diagnostic protocol for HIV. Question 9. A client with chronic renal failure recognizes an adequate amount of high biological value protein when they select Option A. Raw carrots. Option B. Apple juice. Option C. Whole wheat bread. Option D. Cottage cheese. The correct answer is option D, cottage cheese. High biological value proteins contain all essential amino acids. Dairy products like cottage cheese are excellent sources for CRF patients.